Namaste, good evening. This is Dr. Aparna. I am an Ayurvedic psychotherapist, a passionate Ayurveda and psychotherapy infopreneur, medical writer. In my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally, I come up with discussions on Ayurveda, psychotherapy, mental health, and related aspects. In the previous couple of sessions, we were discussing on about adolescent mental health. We are discussing about various adolescent mental health disorders, eating disorders, ADHD, and today we are discussing on mood disorders in adolescents. So, when I talk of mood disorders in adolescents, mood disorders are roller coaster of emotions. So mood disorders are a group of mental health conditions that primarily affect a teenager's emotional state. So unlike normal teenage mood swings, mood disorders are characterized by persistent and intense emotional states. So, what happens is these persistent and intense emotional states, that is, mood swings, significantly disrupt the teen's daily life. So, commonly the symptoms could be if it is a depression, you know, suppose there are many mood disorders. So for example, if I take emotional changes, that is in depression, it could be deep sadness, hopelessness, feeling worthless, irritability, and crying spells. So, if I take mania or hypomania, like in a bipolar disorder, so it could be extreme happiness or euphoria at once, racing thoughts, increased energy levels, and risky behaviors, and talking excessively. And in the hypomania, it is complete, opposite. So likewise, changes in the behavior, it could be social withdrawal, it could be loss of interest in hobbies, it could be changes in sleep patterns, sleeping too much or sleeping too little, changes in the appetite, so significant weight loss or significant weight gain. It could be difficulty concentrating, fatigue, neglecting responsibilities. So the physical symptoms could be headaches, stomach aches, body aches, without a physical cause, without any cause, getting headaches, abdomen aches or and body aches. Next could be, thoughts of self harm or suicide. This is in severe, cases. So mood swings could, have an persistent and intense emotional impact on a teenager. So for is here, if I have to talk about some example scenarios, that is, let's consider major depressive disorder, which is one of the disorders, which is one of the mood disorders. So let's consider a girl who is 16 years old, once bubbly and social, has become, withdrawn and quiet. So she sleeps for most of the day, neglecting her schoolwork. She avoids social gatherings and has lost interest in her favorite activities like playing basketball. And she constantly criticizes herself and feels like a burden to her friends and family. So this is one of the example. If a mood disorder is of major depressive disorder, these could be the symptoms. The next disorder we are discussing, an example could be a bipolar disorder. A 15-year-old boy, usually calm, he is usually very calm, has recently started experiencing episodes of extreme excitement. He talks incessantly about grand ideas. He barely sleeps. He engages in risky behaviors like, spending spree. He spends too much, and he drives recklessly. So these episodes are followed by, a deep sadness where he withdraws from everyone and sleeps excessively. So bipolar is, one is maniac and other is a hypomaniac, so both are seen here. And the third example could be an example, if we take an example of disruptive mood dysregulation disorder. There is a disorder named disruptive mood dysregulation disorder in mood disorders. So a 14-year-old normally easygoing girl has become increasingly irritable. So a minor, inconveniences trigger explosive outbursts of anger. So for simple, reasons, she expresses explosive outbursts of anger, often accompanied by yelling and crying. So these outbursts happen at home, at school, and with friends, so causing significant strain on her relationships. So these are some examples of how mood disorders can manifest, differently in, teenagers. So impact, so what does how does the mood disorder, impact a teenager's life? It could impact by poor academic performance. It could impact by strained relationships with family and friends. It could impact by increased risk of substance abuse, and in some extreme cases it could impact by self harm or having suicidal thoughts. So the important thing is, if you suspect a teenager, might be struggling with a mood disorder, it is crucial to seek professional help from a therapist or a psychiatrist. So, early intervention and proper treatment can make a big difference in their overall well being and future. Next is, many of them ask me how, what are mood disorders? What are the major mood disorders that is seen in adolescents? So, in adolescence, which is majorly seen, the disorder which is majorly seen is major depressive disorder. So, the signs and symptoms here in the depressive disorder could be, a depressed mood or loss of interest in activities for at least, 2 weeks, and most of the day, nearly every day. So, this should continue, at least the depressed mood or loss of interest in activity should continue at least for 2 weeks. It should be most of the day, and it should be every day. See, at least four additional symptoms like significant weight loss or significant weight gain, sleep disturbances, either excessive sleeping or not sleeping at all, and psychomotor agitation or retardation, and fatigue, feelings of worthlessness, guilt, and they have difficulty focusing or concentrating, recurrent thoughts of death or suicide. All these symptoms would be seen. And prevalence is as reported by the National Institute of Mental Health. you know um, MDD affects about 3.1 of the adolescents, in a year. So 3.1% of the teenagers are affected by, major depressive disorder every year. So if we have to see the causes, likely it could be a combination of biological, it could be brain chemistry or genetics, it could be psychological stress or negative thinking patterns, and it could also be due to social factors, that is family history of mental illness or social isolation. So, major depressive disorder can significantly impair a teenager's academic performance. It could impair social relationships and overall well being. It can also increase the risk of substance abuse and suicide. So this is about major depressive disorder, and the next disorder, which mood disorder which is prevalent, is bipolar disorder. See, bipolar disorder could be manifest in, like in bipolar 1 disorder or bipolar 2 disorder. See, when I talk of bipolar 1 disorder, one or more manic episodes, that is, it could be elevated mood or euphoria, it could be racing thoughts, it could be increased energy, it could be risky behavior lasting at least 7 days, or it could require hospitalization. The elevated mood and the racing thoughts are so severe that it could require hospitalization. And then comes the hypomanic phase or the depressive phase. Here the teen may also experience depressive episodes, as mentioned in, as major depressive disorder. Here also there is a phase of depression which could also last for up to 7 days. Next is bipolar 2 disorder. The same thing, a pattern of at least one, depressive episode, that is hypomanic episode, less than a manic episode, less severe than a manic episode. Here the manic episode will be more severe and the hypomanic episode will be less severe. So this is bipolar 2 disorder. If you want to know more about bipolar disorder and the types, I have discussed it in detail in two of the sessions. You can go refer that session. So here causes, here if I have to talk about, National Institute of Mental Health estimates 2.3% of teens experiencing bipolar disorder every year. And the causes, it could be genetic, a combination of genetic and environmental factors. That means imbalances in the brain chemicals might also play a role in the neurotransmitters. All these can also play a role. So how this impacts, the extreme mood swings of bipolar disorder can be very, disruptive to a teenager's life, so causing problems in school, causing problems in relationships, in friendships, and overall functioning. It will hamper the daily routine of, the teenager. So the next mood disorder is disruptive mood dysregulation disorder. I don't think you would have heard this disorder. This is called DMDD, that disruptive mood dysregulation disorder. See, here what happens is severe recurrent temper outbursts that are out of proportion, to the situation. There are temper outbursts which are out of proportion to the situation, which occurs several times a week. This happens at least for a year, you know and these outbursts can be verbal, physical, and be accompanied by intense anger or irritability that lasts for hours. So, and then difficulty controlling these outbursts is evidence in most settings. That is, he or she cannot control these outbursts, you may be at school, at home, or with peers. So this disruptive mood dysregulation disorder, this is a relatively new diagnosis, and this affects, adolescents up to 1.2% every year, according to National Institute of Mental Health. So the exact causes of this disease is not known, but it could also be a combination of, biological and environmental factors. It could be genetic, it could be due to neurotransmitters, brain chemicals, and environmental factors. So impact here is what happens is this frequent temper outbursts can strain relationships with the family as well as with the friends, so leading to academic difficulties and increase the risk of developing other mental health condition. So it is very important for each of us to remember that a mental health professional should, conduct a proper diagnosis, and then only come to a conclusion. So early intervention and treatment, as I said, it will significantly improve the teenagers, overall well-being. So these are some of the, adolescent mental health disorder, especially the mood disorders, in which affect, which have, prevalent impact, which are prevalent and impact a teenager's life a lot. So thanks for staying tuned. If you have any queries, concerns, or suggestions or thoughts, you can just put it in the comment section. And thanks for watching. Namaste.